Welcome to Vet Ranch. I'm Dr. Carrie. I would like to introduce you to this little puppy that we just pulled from our local shelter. They asked me to come and take a look at her because she was, I guess, surrendered. As you can see, she's very purple, but the story with that is, I guess there's some wound spray that's this purple color, and she's got a ton of wounds, so I guess the previous owner just sprayed her down with this. The story that we got was that she was mauled by another dog, and I guess they tried to treat the wounds at home, and then when they couldn't, they surrendered her for euthanasia. So we are going to kind of see what's going on. As you can tell, she seems pretty out of it, and I'm not really sure when these wounds happened, but what we're going to do is put her under general anesthesia, and then we'll show you more of what's going on. She's really painful. I can't get anywhere near her, and I certainly don't want to make her hurt by touching her. So we're going to go ahead and sedate her now. We have her sedated pretty heavily. This ear, this is why she was holding her head kind of sideways. She has got so much just disgusting smelling pus in that ear. Tons of infection going on. I'm guessing she got bit probably here and then infection set in. So we need to flush that out and clip and clean everything. Yeah, here's the bite right here. Probably went through and then infection set in inside the ear too. Poor thing. And then these are the wounds kind of on this chin and neck area right here. Kind of shaved that already a little bit. Pretty deep, so you can see that. It's got this opening like literally under her chin that we can just stick our finger in. So that is definitely going to have to be addressed. I just want to show you the end result. We cleaned out this ear, and we're going to instill some long-acting ear medication in there. That way it can kind of sit in there and work, because I think part of the pocket is in there. Let me do that real quick. And then we have drain tubes in because there's a huge pocket here that had pus in it. So you have a drain tube going from here to here, and we flushed everything out. And then we have another drain tube because there was that big laceration here going from this side to this side. So the important thing with these is that you need to make sure that you get adequate drainage of that pus kind of while you're treating these wounds. So we're gonna put a cone on her, wake her up right now. She's on 2 types of antibiotics. We actually put an IV catheter in her. She's pretty dehydrated, probably from not eating or drinking. And then we're gonna set her up on fluids overnight and continue antibiotics and continue heavy duty pain meds. So only the best for this girl from now on. So we were just checking her over to make sure we didn't miss anything else, and we had missed a little spot here on her head, which we lanced, and it was full of pus, almost like a cap sticking up. So, you know, she's got these wounds on her eye too. We are so lucky that she did not get bit in her actual eye, because then we might be at the point of having to remove her eye as well. So we flushed that out really well. And then we're just going to watch that one as the kind of days progress and we see how she's doing. She's awake from anesthesia, and I just wanted to show you something really quick that we noticed too. Her eyes are kind of darting back and forth, and she's got this head tilt that we showed you. I don't know if you're going to be able to see, but it's because that left ear the inner ear has been affected, and she's got what we call a head tilt and nystagmus. Let me show you her eyes right here. So that hopefully will resolve with time when we get this ear infection treated, but this poor thing is just completely torn up, and it breaks our heart that she went who knows how long, several days without any treatment whatsoever. So hopefully we can get her back to normal, and then we can get her head tilt to go away as well. It's been about 24 hours and we're checking on our little Violet. You know, she didn't want to eat any canned food, and I just offered her a few kibbles of dry, which she has eaten a couple pieces, so that's definitely a step in the right direction, since we couldn't get her to eat all overnight or this morning, so I'm super happy with that. We are just looking at the drain tubes here, and they've stopped draining, so we are going to go ahead and pull those out. This one on the side. The ear looks pretty good. We'll clean that out again, and then we're going to pull this one as well. And The eye nystagmus is gone, so that's good, but she still has a head tilt, so that's probably going to take a while to go away. But we're going to go ahead and pull those out real quick. So just kind of cleaning her ear out again, but you can see where we took the tubes out. There's the holes here. It's okay about it. Here on this side right here, and then under here. And this big laceration is still closed really well, so everything looks good. So far, so good. It's been 1 week today, and Violet is looking really good. You know, her head's still tilted a little bit, but it's so much better than it was. She was falling to the left and kind of rolling outside, which she's not doing anymore. And we cleaned out her ear today and applied more ear medication. But you can see that all of these kind of holes where the drain tubes were, they're all closing up, and in just a few days we'll be able to take out our sutures and then give her a bath. We are rechecking our little Violet. She's doing awesome. It's been about 12 days now, and we are going to take out these sutures at the bottom, which is completely healed up, and we've been waiting to do that to give her a bath. She still has a head tilt, and honestly she may always have that issue, but certainly she's doing a lot better. She doesn't feel like she's falling to the left outside. At least she doesn't fall anymore, which she did before. So we are super happy with her progress. So it's time to give her a bath. Well guys, it is the final kind of checkup for Violet. We are going to tell her goodbye, and she's now adoptable. She is a different dog now than that septic little scared dog that first came from the shelter. She's really coming out of her shell and loves to run and play and have fun. So we're really getting to see that goofy terrier side of her. So thank you guys for everything that you do as far as watching our videos and donating to our cause. We really appreciate you guys, and Violet and I say thank you. Bye-bye, guys.
Sometimes when you're feeling young and you're feeling tough and you're all caught up, but you don't walk right and you don't talk right, and there ain't nothing wrong with feeling strong, babe. I know what you're going through. I know 'cause I've been there too. I don't walk right and I don't